can never go wrong with experience. For 68 years, the Nairobi Hospital has excelled and earned recognition in the provision of quality healthcare in the African region and beyond. The combination of highly skilled modern medical and non-medical technology has placed the hospital on top in undertaking a wide range of routine and complex medical investigations and procedures, including open heart surgery, kidney transplants, trauma care, orthopedic surgery, neurosurgery, laparoscopic surgery, and cancer therapy, among others. The Nairobi Hospital, over 60 years of quality healthcare.
Our key functions range from the point of
Chairman, Board of Management, Vice Chairman, Board of Management, members of the Board of Management, the Chief Executive Officer of the Nairobi Hospital, all KHA members present, and members of management. We take this opportunity to welcome you to this event, that is the KHA Open Day, which was programmed to be hybrid, so that we have some of you here physically and some of us are logged on onto this platform. We have been with some of you since 10 a.m. when we had an opportunity to serve you through our clinical team, and we also had an opportunity to have a site tour to our facilities. Now, I wish to ask Father David to offer an opening prayer for this session. Thank you.
Good afternoon. Let us all bow our heads and pray for God's blessings. In the name of the Father, and of the Son, and of the Holy Spirit. Pour forth, I beseech you, Lord, your mercy, your blessing upon this hospital, which you have brought into existence with the hands of your servants. Increase our resources, fortify our strength to continue your work of ministering to your people. Preserve and sanctify those whom you have called to participate in your healing ministry, our doctors, nurses, and all our staffs. Loving Father, I pray that you may protect, support, and sustain them in all that they do. Look upon their needs and fill them with abundance of your prosperity. Give them the necessary skills and knowledge they need to serve your people. And may the patients who come here experience your love and healing through our services and presence to them. Spirit of God, source of all wisdom and gifts, I thank you for who you are into our lives and invoke your presence in this gathering. We give you thanks for the gift of leadership in this hospital. Bless our leaders in their plans and vision of this hospital. Renew in them all the spiritual gifts you granted them. And may they feel your presence in their weakness. And when they encounter difficulties in the work that you have called them to do, support them with your love. This we ask through Christ our Lord.
Thank you, Father David. Members, welcome again to this hybrid KHA Open Day. During this forum, you'll get a chance to view high-level diagnostic centers of the hospital, which enables the hospital to live up to its promise to continue leading as the quality healthcare quality provider in East and Central Africa. It is now my pleasure to invite Mr. James Nyamongo, the Chief Executive Officer of the Nairobi Hospital, to deliver his welcome remarks and update you members on the performance of your facility. Welcome, CEO.
Of the Board of Management and members of the Board of Trustees of the Kenya Hospital Association, members of the KHA logged in on this particular virtual platform, senior management colleagues, ladies and gentlemen. Mine is to take through and give a highlight of the institution's performance for the last 4 months. That's the period covering January up to April. The key highlight areas I'll make to members: we have managed to turn around the deficits in the previous years by registering a surplus of 30 million in the first quarter of 2023 against a challenging economic environment, both globally and domestically. Our occupancy has continues to grow this year, averaging 66% compared to 64% last year. Revenue has grown by 9%, following the receding trend in COVID-19 cases, and approval from the UNE repurposing of East Wing is underway. We have also put in place different initiatives to turn around the performance of the institution, including cost containment and revenue generation plans. Credit control up to April 2023. Credit control strategy has been successful, although with some challenging on the National Hospital Insurance Fund and customers. Credit control strategy has been successful, although with some challenging on the NHIF and cash payers. At the end of April, the outstanding debts stood at 2.2 billion, down from 2.5 billion in April 2022 last year, and 3 billion as the start of 2021. This, as we have registered a tremendous progress, especially on debt corrections, to ensure that we have improved our cash flow statements. NHIF debt stands at 0.5 billion, and cash payer debt stands at 0.5 billion, majority of them arising from the emergency cases. We are in engagement with the National Insurance Funds on the settlement of these balances, despite the National Treasury's constraints while developing a new strategy to deal with cash payers in a manner that is empathic to our patients. Performance enhancement measures. As an institution, we have an obligation whereby we have to put measures which will ensure that we are sustainable and we are delivering services to our members and our patients and other stakeholders. We have progressed on the main entrance work, which we estimate will be completed by June 2023. By main entrance, I mean there's some facilities which we are putting from the main entrance, that is the pharmacy, we have occupational therapy, and the new theaters. These are areas which we have focused on patient centrality at an institution which will enhance our service delivery. The new theaters in the main entrance are projected to be completed by August 2023. The new pharmacy and the laboratory are now operational, and I think most members have enjoyed those facilities. The new theaters will be completed by that time, by August 2023. We also are working to increase our in-suite rooms allocation to respond to our patient preference. As we came out of the COVID-19, what has transpired is that most of the members of the public, our stakeholders, they are opting to ask for private rooms. They don't want to go to open wards. So we are looking into that, and that's the case we are addressing as management to ensure that our people get what they want. Various investment in medical equipment has been achieved by committing 700 million Kenya shilling in medical equipment investment, which has resulted to a major upgrade such as, one, the cardiac biplane C-arm, the MRI smart bat upgrade, the ophthalmology microscope, gastroscopy, and the duodenoscopy. Mammography machines are also been installed. We have 128 slice CT scan, which is on track. Fluoroscopy machine is also on track. And neuromicroscope, it's also on track. As an institution, we have taken the issue of governance seriously. And this is, as an institution, we have ensured that we have put a governance instrument in place to ensure to support our operations. The review of human resource policies and procedures manual to consolidate the standalone policy was completed and approved by the Joint Board of Management and the Board of Trustees in December 2022. This manual has been operationalized. Among other reforms, the manual clearly entrenches training, performance management, and recruitment processes to enable more efficiency and running the HR practices in the institutions. This will protect this institution from any litigation coming out on the way we do it because we are not following the rule of law. The supply chain and procurement manual is being reviewed. That's the second. We made the first draft, and we are now reviewing it to conform to the service delivery and also for the current procurement practices. This is in view of enabling more efficient procurement practices that is responsible to the dynamic needs of the hospital. Our investment in better hospital management system is at an advanced stage, and this is for the implementation. It is for implementation for this year. This also is one area which we are putting a lot of investment to ensure that we have improved on service delivery, quality healthcare management, and also to consolidate and the preparation of our financial statement to be accurate and submitted to members promptly. Payment of doctors, which has been a very thick thing in the fresh for the institution, we have now enhanced it, and we are making payment to various doctors twice a month to promote efficiency. Members, at this juncture, I will invite Dr. Kioma, the Deputy Medical Director of Services and Research, to give you a glimpse of what is in it for you members in your facility through a virtual tour. Dr. Kioma.
Thank you, CEO, and good afternoon, KHA members. Allow me to take you through a brief of some of the areas we have enhanced the delivery of healthcare services. And I'll start with the face of the hospital. That's our accident and emergency department and the OPCs. And we do know here our biggest challenge is usually turnaround times. So we have instituted several measures to reduce turnaround times, which is a big burden. The first thing we have done is to make sure that we enhance the diagnostic capability of the A&D. We have a functional laboratory, we have a functional radiology suite at the A&D. That makes it easier for diagnostic services to be done there quickly. We have also instituted a queue management system, which also enhances the flow of patients. We do know that it started with the banks, but the healthcare sector has also quickly picked, and this, of course, enhances the satisfaction of our patients. We've benchmarked locally and internationally on what challenges also members go through at the A&D, and one of them is financial clearance for both admission and discharge. And we have looked at ways to mitigate that. And one of these ways is to bring on board care managers. And these are people who are going to be the link between the users of the services and the third payers. And that will definitely improve the flow in the A&D. The other area which we have enhanced is services to our dignitaries, and that includes KHA members. And what we did is to establish a VIP clinic there, which all KHA members are entitled to. And that is at the normal charges. You do not need to pay more to be seen at the VIP clinic at the A&D. Our critical care services, we have been pace setters in this area for many years in offering the best critical care services, both for adults and children. And we have enhanced this both by having the light equipment, having the requisite number and qualifications of staff. And here I'm talking about both nurses and doctors. We have also enhanced our service delivery through evidence-based care. We have formed care teams to take care of patients with complex conditions. I'll give an example. For example, interventions we have initiated to reduce what we call hospital-acquired infections. And we are proud to say for the first 6 months, for example, we have not had any ventilator-associated pneumonia, which is a real big feat in this era of multi-drug resistant infections. We have enhanced the care of both very young babies and the older children through a neonatal intensive care unit. As you know, we have a maternity package, maternity services that are made affordable through a package. And as a continuum, we have established care for both neonates and older children through a neonatal intensive care unit and a pediatric intensive care unit, which is actually a new addition to the hospital. The COVID-19 pandemic did cause a big disruption in healthcare globally, and we were at the forefront, especially after the COVID-19 treatment facility was established. We managed over 1,890 patients in that facility with very good outcomes, up to 92%. We did present this in the International Health Federation World Health Congress last year in November in Dubai, and it was actually not a mean feat comparing with the experiences from other institutions. The last patient was admitted there in July last year, and since then we have been working on repurposing, and repurposing has been initiated after extensive consultations through all stakeholders. And here is both the UN as our partner in this project, admitting staff who are key stakeholders, and also looking at the disease burden and the needs of healthcare within the country. We continue to enhance our cancer center facilities. As you know, we were among the first hospitals to establish a dedicated cancer center, and we have made it our goal to make sure we still remain very competitive. There are a few additions, for example, a PET scan, which would make it really top-notch, and these are ideas that are being considered. We have also made quite significant strides in renal services. I talk about renal service because it's becoming more and more of a common problem, especially with diabetes and hypertension also being more prevalent. When the kidney fails fully, we have two options. One is to do dialysis, the other one is to do transplant. We have enhanced both. The first is we have established a new mode of dialysis called hemodiafiltration, which is more tolerable to the patient. It eliminates the toxins better. Although slightly more expensive, it's definitely more value addition. We have done more than 11 kidney transplants, which is also packaged to make it affordable to all citizens within the country. So that's a brief. We'll watch a few videos to show these particular areas of service enhancement. Thank you.
Thank you,
See
Dr. Kioma. Dear KHA members, the Chair of the Board of Management is hosting this meeting and will deliver his keynote address. But before he takes the floor, let me invite you to a virtual tour of our key facilities to see for yourselves how our store is discharging this mandate of delivering quality services to our patients. This virtual tour covers radiology, physiotherapy, critical care units, neonatal intensive care unit, College of Health Sciences, and pharmacy.
When seconds count, experience makes the difference. The Nairobi Hospital Accident and Emergency Center is situated in close proximity to the laboratory, radiology theaters, labor ward, cardiac catheterization lab, and the critical care units. With a network of labs, you are guaranteed of accurate medical test results. The Nairobi Hospital is a center of renal excellence, providing cutting-edge technology through more than 10 dialysis machines. As a patient, you are certain to get quality medicine at the best possible prices at our fully stocked pharmacies.
This is a department that is situated next to the main gate of the Nairobi Hospital. It's a department which receives all kinds of emergencies, depending from pediatric all the way to adult patients. It's a department that runs 24 hours, 7 days a week, and it's manned by an emergency physician and assisted by a unit manager and different team leaders in the department. We receive patients from all parts of the country and also outside the country. We get our patients from outside the country through our HealthPad that is situated at our car park H, and we lift the patients to the emergency department via ambulance services. Our ambulance services are also 24 hours, 7 days a week, even during public holidays. The unit is well equipped with good laboratory services. We have an in-house laboratory that runs 24 hours, 7 days a week. We have a CT scan in our department that also runs 24 hours, 7 days a week, including our MRI machine in the A&D department. We have an ultrasound department within our unit that also runs 24 hours, 7 days a week, and a wide range of consultants within the hospital. Also, our nurses are specialized nurses that are trained in different specialization in the Department of Nursing in our school. And above all, when we receive our patients, we have our turnaround time for seeing patients within the A&E department. We have patients that we color code as red, blue, yellow.
My name is Dr. Ruben Okioma. I'm a critical care specialist. My background is general surgery. We have 16-bedded ICU at the Nairobi Hospital. This is an open ICU, which means we admit patients with different conditions. At times, we admit children as well in the ICU, although we have recently opened a pediatric intensive care unit. We get patients being admitted to the ICU from different sources. Majority of the patients come from the accident and emergency department, but we do get patients coming from the operating room. Those who have had major surgeries such as kidney transplant and open heart surgery. We also do get many patients being referred from outside Nairobi and also internationally. We are actually a very prominent medevac center for the tourism industry within the East African region because we work closely with quite a number of international insurance companies. The purpose of admitting a patient to ICU in most cases is for support, what we call organ support. This is where you find a patient who needs support because one of their organ systems is failing. The other reason is for close observation, close monitoring. Because within the ICU, we have all the advanced equipment for monitoring a patient's well-being, what we call the physiology of a patient. So we have various forms of organ support.
My name is Dr. Rohini Patil. I'm a pediatric intensivist. I'm here to introduce to you our pediatric intensive care unit. Let's talk about pediatric intensive care unit. What is it? It's the place where severely ill children or critically ill children are admitted. They have special needs. Sometimes they need intensive care monitoring, repeated supervision, close monitoring. They also need advanced life supports, resuscitation, and sometimes even end-of-life care. I introduce to you the pediatric intensive care unit of our hospital, which is a 5-bedded hospital. It takes care of children from birth to 16 years of age. So all the children who have issues, maybe it is respiratory problem, breathing problem, heart issues, kidney problem, maybe they have come from a surgery or even injuries, which are very common in children, are all taken care in this unit.
Because the needs as well, reassurance, and we are able to actually deal with their issues as they arise. And sometimes we do allow the parents to even leave a caretaker, maybe the nanny, to stay with the baby so that they can continue with the other duties as required.
We are at the gas plant where we supply most vital gases for the hospital. Today I'll take you through what goes on in gas plant and how we have managed to save from the plant. First, here we supply oxygen, we supply vacuum, and we supply medical air and nitrous through pipe system. The oxygen plant, initially we had a liquid tank that used to serve the hospital, and it's used to be serviced from outside by a company named BOC. But then during the time of COVID, the oxygen was limited even for other companies to supply us to sustain our demand in the hospital. So the hospital resorted to bring a big capacity plant that can supply it within internal supply and its outlets. Currently, we have oxygen with a capacity of 1,500 that we use to supply the main hospital, and also we use it to fill the cylinders that we use both in OPCs and the main hospital. Nairobi Hospital has also managed to save money through the plant by minimizing the amount of cylinders that we buy from other vendors, from oxygen to almost 0%. I also would wish to assure the clients, the general hospital, that the plant is sufficient to supply, is giving sufficient supply of oxygen and vacuum that can sustain the plant, the hospital need, both internal and its branch.
This is Renal Unit Department in Nairobi Hospital. My name is Florence Juma. I am the head nurse of this unit. In this department, we do dialysis. Dialysis is about cleaning the blood, mainly when your kidney has failed. You find that when your kidney has failed, it is not able to do its normal function. So we do dialysis to help support you so that you can live a normal life. Dialysis is carried out mainly twice or 3 times a week. And we have 3 sessions, that is morning, afternoon, and evening. For those who would like to exit dialysis, we also do transplantation, and we've had very successful transplantation within the hospital so far. We have a very qualified and specialized team. We have a nephrology doctor, nephrology nurses, and we're also supported by the ICU nurses who also work together with us. Apart from that, we also have the dietitians who help you to know what you're supposed to eat. We have counselors who also help you to know how you can go through the journey. Sometimes it is not easy, but with the help of the counselor, one is able to accept and adjust their life. And here we are welcoming you. We have a capacity of 19 spaces. We have 2 types of machine, that is the Studiol X and the Dialogue. They are very high-performing machines that when you are dialyzed, you come out feeling good. Apart from just offering hemodialysis, we've also upgraded now to hemodiafiltration. Hemodiafiltration is another form of dialysis, but with hemodiafiltration, you have lesser complication across dialysis, so you find that you don't get the bone complication, you don't get the blood pressure going down, and also you find that when you're done with dialysis, you feel far much better.
The oxygen was limited even for other companies to supply us to sustain our demand in the hospital. So the hospital resorted to bring a big capacity plant that can supply it within internal supply and its outlets. Currently, we have oxygen with a capacity of 1,500 that we use to supply the main hospital, and also we use it to fill the cylinders that we use both in OPCs and the main hospital. Nairobi Hospital has also managed to save money through the plant by minimizing the amount of cylinders that we buy from other vendors, from oxygen to almost 0%. I also would wish to assure the clients, the general hospital, that the plant is sufficient to supply, is giving sufficient supply of oxygen and vacuum that can sustain the plant, the hospital need, both internal and its branch.
This is Renal Unit Department in Nairobi Hospital. My name is Florence Juma. I am the head nurse of this unit. In this department, we do dialysis. Dialysis is about cleaning the blood, mainly when your kidney has failed. You find that when your kidney has failed, it is not able to do its normal function. So we do dialysis to help support you so that you can live a normal life. Dialysis is carried out mainly twice or 3 times a week. And we have 3 sessions, that is morning, afternoon, and evening. For those who would like to exit dialysis, we also do transplantation, and we've had very successful transplantation within the hospital so far. We have a very qualified and specialized team. We have a nephrology doctor, nephrology nurses, and we're also supported by the ICU nurses who also work together with us. Apart from that, we also have the dietitians who help you to know what you're supposed to eat. We have counselors who also help you to know how you can go through the journey. Sometimes it is not easy, but with the help of the counselor, one is able to accept and adjust their life. And here we are welcoming you. We have a capacity of 19 spaces. We have two types of machine, that is the Studio X and the Dialogue. They are very high-performing machines that when you are dialyzed, you come out feeling good. Apart from just offering hemodialysis, we've also upgraded now to hemodiafiltration. Hemodiafiltration is another form of dialysis, but with hemodiafiltration, you have lesser complication across dialysis, so you find that you don't get the bone complication, you don't get the blood pressure going down, and also you find that when you're done with dialysis, you feel far much better.
Board of Management, members of Board of Trustees, and after which he will deliver his keynote address on the transformation of the Nairobi Hospital into a world-class multi-specialty center of healthcare excellence. Mr. Chairman.
My dear Kenya Hospital Association members, I'm delighted to host you here today during this hybrid open day. I trust you are all keeping well and taking care of yourselves and your loved ones. Let me start by introducing the members of the Kenya Hospital Association Board of Management. On my right here is Honorable Dr. Chris Bishage, who is the Vice Chairman of the Board of Management and a member of the Finance and Investment Committee and Human Resources Committees of the board. Let me introduce other board members, some of whom are among this congregation. They have appeared physically and others are logged in on the virtual platform. Dr. Fred Kabuni. Dr. Fred Kabuni is the chairman of the Medical Advisory Committee of the board and a member of the Human Resources Committee and the Infrastructure Projects Management Committee. Next is Dr. David Githanga, the chairman of the Audit, Risk and Governance Committee and a member of the Finance and Investment Committee. Next is Honorable Justice, retired Philip Waki, chairman of the Infrastructure Projects Management Committee and a member of the Human Resources Committee. Next is Mr. Philemon Waisaka, whom I can see in the hall, the chairman of the Human Resources Committee and member of the Finance and Investment Committee. Next is Dr. Magdalene Mudhoka, the chairperson of the Finance and Investment Committee and a member of the Human Resources Committee. Next is Dr. Gradwell Kiarie, the vice chairperson of the Medical Advisory Committee and a member of the Finance and Investment Committee and the Infrastructure Projects Management Committee. Next is Mrs. Rudmila Shitaka, member of the Finance and Investment Committee and the Audit, Risk and Governance Committee. Next is Dr. Louis Litwa, a member of the Human Resources Committee and the Infrastructure Projects Management Committee. Next is Mr. John Sergon, a member of the Finance and Investment Committee and the Audit, Risk and Governance Committee. Next is Dr. Joe Kamau, member of the member of the Finance and Investment Committee and the Human Resources Committee. And also we have got Mr. Sami Onyango, who is a member of the Finance and Investment Committee. The other one is the CEO, who is a member of the board, the CEO of the hospital, Mr. James Nyamongo, on my left. Let me now take this opportunity to also introduce the members of the Kenya Hospital Association Board of Trustees. The chairman, Professor Gethu Muigai. Oh, correct. Professor Gethu Muigai is the chairman. Next is the vice chairman, Dr. Joseph Aluosh. Next is trustee Esther, Honorable Esther Murugi. Next is Mrs. Jane Muigai Briggs. Next is Ed Ouko and Professor Alpha Ogiti. Those are the members of the Board of Trustees. My fellow members of the Board of Management, it is now my pleasure to deliver my note, and I trust you are well. The CEO and management team, distinguished ladies and gentlemen, good afternoon. I wish to welcome you all to this hybrid Kenya Hospital Association Open Day. This occasion presents us with an opportunity to interact with the hospital's operating environment and assess how far we have traveled on the journey towards developing and sustaining our facility, our strategic direction. Our transformation journey has enabled us to sustain our business growth in a rapidly evolving business environment. We have continued to deepen the key drivers of our change process, including governance, institutional restructuring, staff harmonization, and resumption of capital investment projects. Our financial results, despite the challenging business environment, the performance and financial status of the hospital remains stable. This year, our growth has been steady compared to last year. We are optimistic that the business shall resume a sustainable growth path, and the detailed financial performance the Chief Executive Officer has laid before you is a testament of our optimism. Governance. The Board of Management has entrenched robust governance structures aimed at reducing risks and vulnerability of the business. The hospital's management through the board has developed and continued to develop such appropriate policies and operating procedures to support the integrity of our business processes. In December 2022, the Board of Management and Board of Trustees jointly approved the human resources policies and Procedures Manual, which was a product of rigorous review and consolidation of the multiple standalone human resources policies then in place. We have integrated the latest technologies to enhance our efficiency. The board approved the procurement and installation of the latest enterprise resource process and hospital management information system to facilitate real-time and quality service delivery. The implementation of this system is underway. This system shall streamline the hospital's financial systems and prevent opportunities for fraud. Our infrastructure development. We have reactivated our priority capital investment projects to support our business growth, and a number of the capital projects have either been completed or are nearing completion. These include new laboratories, theaters, pharmacy, and hydrotherapy. The new pharmacy and laboratory are now operational. The completion of the western entrance of the hospital is underway, and it is projected to be completed by August 2023. We have progressed well on main entrance works, which we estimate will be completed by the end of this month, 2023. The new theaters housed in the main entrance are projected to attain completion and commissioning by the end of August this year. We are also working towards increasing our en-suite room allocations to respond to our patient preferences. The board has committed over 700 million shillings in medical equipment investment, which has resulted in major equipping and upgrading, which have been elucidated by the Chief Executive Officer in greater detail. Members, you have been shown the locations within the hospital where these equipments are installed. Our priority services for Kenya Hospital Association members. The board remains conscious of the health care needs of all KHA members. And in this respect, we have dedicated the new VIP section of Accident and Emergency Department for use by KHA members. You are entitled to outpatient services in this state-of-the-art facility, and you are urged to make use of it whenever you are in need. Additionally, our queue management system is programmed to fast-track members in the patient journey. In conclusion, let me take this opportunity once again to appreciate all of you for participating in this event. Your contribution to the performance of the hospital is always treasured. And I thank my fellow board members, management staff, for working together in the transformation journey, and our individual and collective commitment is to continue building a sustainable and trusted brand. God bless you all. I now invite you to join me in a virtual tour of the key facilities in the hospital and hear Dr. Samuel Odede, the Director of Medical Services and Research, shall give you an insight into the tour, particularly addressing the facilities which have been upgraded in order to deliver our brand promise. Dr. Odede.
Thank you very much, Mr. Chair. Chair, Board of Management, Chair, Board of Trustees, the Board of Management, the Board of Trustees, CEO, Senior Management, hospital staff, and the main people of the day, our raison d'etre, reason to be here today, the Kenya Hospital Association member. It's my distinct pleasure to welcome you to this KHA open event, and it's my prayer that you've accessed our medical camp, which is down the hall to your left, room 5, which will still be open even as we conclude this meeting. My name is Samuel Odede, orthopedic surgeon and also medical director. As Major Dr. Ndurangu has alluded to, there have been new developments and infrastructure that all feel chime and resonate with our overall mission and vision of the Nairobi Hospital. Healthcare with a difference, and to harness technologies that are modern, efficient, ethical, and green, which will guarantee dynamic, continuous quality improvement. I'm happy to announce to our KHA members that overall, if you look back from 2019 all the way to now, our combined indices for quality improvement have improved from 78% in May 2019 to 87% as we speak today, no small part due to the fantastic work of our nursing team and also our combined admitting staff association, the doctors. So thank you for that. As we talk about this new infrastructure that have led to all this, I have to start with our pet project, the biplane catheterization lab, otherwise known as the biplane lab. This is the 4th of its kind in Africa, but the most modern in Africa, capable of doing neurovascular services, dealing with stroke, so minimal invasive, dealing with stroke at a very short time, dealing with what the lay people will refer to as heart attacks. We call it interventional cardiology, dealing with interventional radiology and peripheral vascular disease. Also, changing the tempo of your heart. These are all technical terms that I won't get into specifics, but I'd like to highlight to our esteemed KHA 2 watershed moments that happened in the last 2 weeks. We were able to diagnose and treat somebody with a stroke in our new biplane lab. It's called biplane because it has 2 X-ray sources. It's able to deliver minimal radiation, but at a faster rate with crystal clear images. We're able to do that. Then the other thing we're able to do is to do, for the first time in Nairobi Hospital since 1997, open heart surgery where we did something called coronary artery bypass surgery for somebody with a very, very complex coronary artery disease. It's instructive to note this patient came from Eritrea to Ethiopia, was supposed to stop in Nairobi for a while before moving to India. We managed to literally, quote unquote, detain the patient here within the Nairobi Hospital and perform this very complex surgery with a battery of teams. This is just to highlight that we are moving in leaps and bounds, and Nairobi Hospital will be the next destination for medical tourism in the entire region. Gone are the days when people go to, we don't mind India, they've done a good job over the years, but gone are the days when people move from our hospital to other areas. The other thing that we've done really well in is the MRI upgrade. It's both old and new. I know it's an oxymoron. Old because it was 8 years old, but it was analog. New because it's brand new. A magnet in an MRI scanner is not movable, so attrition, wear and tear is non-existent. So what we did on behalf of the KHA members, to which we owe a fiduciary obligation to reduce the cost, we managed to keep the magnetic core, but we stripped everything and created a digital platform at 1/3 the cost of what it would have cost to buy a brand new machine. A machine with a bigger clearance, faster working time, good clearance, and digital images that are crystal clear, which will aid our doctors in creating, giving us quality care. So We were green, we saved the environment, and we reduced our carbon footprint. We have a state-of-the-art mammogram. Amongst the tests being conducted to our esteemed KHM members is a breast examination, and should there be any reason for concern, have the comfort and rest assured that there's a state-of-the-art machine that will address any issue in terms of diagnosis and prognosis in the future. Again, a first in Africa is something called a 3D ophthalmic microscope. The Nairobi Hospital doesn't just buy things so that it claims the epithet first in these, best in these. No, we do things strategically with a mission and a vision. And that mission is to create, especially in the ophthalmology lab, to create very good, clear images which will aid the ophthalmologist in doing precision surgery. I'm happy to announce to our esteemed members that the results are already being felt. Patients who would flock in other facilities around the city and including Africa and including East Africa are now beginning to access our ophthalmology services specifically because of this. The other things in the offering, a CT scanner, as our chair mentioned, CT scanner is en route. There's something called fluoroscopy, which will inject dye, so we'll deal with matters of fertility, and we'll have a fertility clinic and other areas where dyes are incorporated into the body. We also have the closely tied to the neurology field is the neuromicroscope, which is on the way coming soon. Now, in terms of infrastructure, physical infrastructure, like the chair alluded to, there is the 2 state-of-the-art theaters. Now, theaters are generally the same everywhere. However, these 2 theaters have what's called HEPA, highly efficient particulate air filters. So that means the air flows in a specific column, but there's a filter to sieve out particles, viron or virus particles, bacteria particles. And so any infection attributed to that air will be obviated by these new theaters. That's not to say the remaining 7 theaters are any less clean. We'll still work on them as we finish this. We'll still work on them, and we'll create a majority of them to follow the same system. Alluded to earlier is the pharmacy and the new pharmacy, which is at the main entrance. I'm sure most of you have seen it. It combines both inpatient and outpatient. It has wider aesthetic spaces with better facilities. And so the KHM members have VIP priority rights. This is not to say that the other our other clients receive lesser services. They still receive superior services, but because of your loyalty and your unwavering support, the reason the Nairobi Hospital is because of you, you will get specialized VIP services. The same will apply for the state-of-the-art laboratory next to the accident and emergency, and also to mention in our Anderson Clinic, which is this building on the 5th floor, we have a new pharmacy shop which will ease the services of the doctors of our esteemed members who access services above. So without further ado, I would want to welcome you to the video, and I once again thank you for your unwavering support for the Nairobi Hospital. Thank you and much obliged.
Never go wrong with experience. For 68 years, the Nairobi Hospital has excelled and earned recognition in the provision of quality healthcare in the African region and beyond. The combination of highly skilled modern medical and non-medical technology has placed the hospital on top in undertaking a wide range of routine and complex medical investigations and procedures, including open heart surgery, kidney transplants, trauma care, orthopedic surgery, neurosurgery, laparoscopic surgery, and cancer therapy, among others. The Nairobi Hospital, over 60 years of quality healthcare.
My name is Dr. Robert Mathengi. I'm a cardiologist who practices at the Nairobi Hospital. My type of cardiology practice is what is called interventional cardiology, which means a cardiologist who not only diagnoses and treats with the medication, but is able to use minimally invasive techniques to treat heart conditions and blood vessel conditions right inside the body. This is what is called an interventional cardiologist. An interventional cardiologist, to be able to do those types of surgeries, to be able to make those kind of diagnoses, needs to see inside the body. Seeing inside the body, everybody knows that if you look with your naked eye, you only see the surface of the skin. You can't see anything else. So long ago, it was discovered that if you use radiation, you can actually penetrate the body and be able to see the internal structures. And if you use other things like what is called contrast, which is literally a liquid that is visible when X-rayed, and you put it into the heart and the blood vessels, you'll be able to see the heart very, very well, study it, and it will flow into the arteries, and you'll be able to image the arteries. When you do that, you are able to see which part of the heart is diseased, which part of the blood vessels are diseased, and therefore think about how to treat them. Remember, the desire of humanity is how you can diagnose and treat diseases without invading the body excessively, without opening it up. Nobody wants to be opened up if there's a way in which you can diagnose or treat that condition without interfering with the body too much or opening it up. And therefore, combining proper use of radiation, proper use of what we call contrast, and the proper equipment, we are able to see inside the body, and we are also able to see where the disease is. And using thin little pipes, what we call catheters, we can direct them to where the disease is and actually treat that disease. We will either scrape that disease that is blocking the blood vessel, or you use a balloon to push out the material that is blocking the blood vessel and therefore impeding or stopping the flow into the organ, if it is the heart or the brain. And now the equipment that helps us to do that is called a cardiac catheterization laboratory. Now, these type of laboratories have been in existence for the last 50, 60 years. They have advanced in the technology. Nairobi Hospital first got a cath lab in 1996 and was actually the first one in the private sector to get a cath lab. Prior to that, only Kenyatta National Hospital had a cath lab, thanks to the national government at that time. But in 1996, the board of the hospital felt it was necessary to advance into that. And that allowed us now to start doing procedures which we call minimally invasive or pinhole procedures, like I've just described, from 1996, 97 up to now. And what has happened is that the technology of that equipment has continued to improve, so that the first cath lab stayed with us for 7 years. It was a second hand. Then we got a brand new one in 2005, which stayed up to 2023 and did a good job. But it was time now to change into another one. And when it came to changing into a new equipment, we did not want to go on doing the same things we do. We wanted to look and see, where can we go? Where are other countries, other institutions outside Kenya? Where are they going? What do they have? What are they able to do? Can we extend the treatments that we have today to other treatments? And that's why the hospital board and administration agreed to purchase the best kind of equipment that would allow us to expand into other areas of help to the patients. Which are these areas? We have been able to treat heart attacks in the cath labs, but with this kind of equipment, we can do it faster. We can do it 24/7. We can do it 7 days in a week, and we can be able to do it faster because the equipment acquires pictures faster. The equipment allows you to use less radiation. It allows you to use less contrast, particularly because it is like a double cath lab in one.
As radiologists, we rely heavily on technology for all aspects of imaging. For MR, because it is such a high capital equipment, we require to have the best in the digital space. So that's why the Nairobi Hospital went and acquired this particular upgrade. And it's actually one of the leading technologies when it comes to digital MRI imaging.
So smart.
The Nairobi Hospital is the biggest private hospital in East and Central Africa. We have all specialties. We have 656 independent consultants, and we have a battery of about 100 hospital-based doctors. We chose to upgrade rather than purchase a new machine because most major medical equipment have substances that can be dangerous to the environment. And so by recycling, we save the environment, we go green. The cost-benefit analysis between upgrading and purchasing a new equipment was very stark. It cost us a third of what we would have spent if we purchased a new equipment. So by getting a third of the cost and saving the environment, our carbon footprint has been significantly reduced.
So the benefits of the upgraded D-Stream Core 2 system are very many. The previous system would actually take a longer time because we'd have to do all the sections one after another. And especially you can imagine if these patients are in pain, they would have to stay in the magnet for almost up to 60 minutes as we're doing each section. The current system has a whole spine table where we can actually do all the images at one go. So that's a huge advantage. We're able to image more patients, and the images are very clear. Image quality has significantly improved since the upgrade. Another thing that has helped with the patient experience is the ambient lighting in the room.
Welcome to the Nairobi Hospital and Department of Laboratory Medicine. I am Dr. Rahul Zode, the Chief Pathologist. We are ISO 15189 accredited lab and ISO 9001 and 14001 certified lab. We are licensed by KML-TTB and we comply to all the requirement of the governing body. We are the team of 10 pathologists and over 100 technologists who are trained and experienced in their respective area of specialties, and they are delivering services across the lab locations. We have a network of operations across the geography of Nairobi, which includes the main lab, 4 satellite labs, and 6 OPC-based labs. The main lab has the different sections of operations such as histology, biochemistry, hematology, microbiology, molecular biology, and immunology.
Welcome to the Nairobi Hospital Pharmacy Department. I'm Dr. Angela Wanjala, currently stationed in the main pharmacy. The Nairobi Hospital Pharmacy offers 2 services. Those are the inpatient and outpatient pharmacy services. We ensure efficient, timely, and safe provision of services. We provide quality medicines at the best possible prices. Our pharmacies are manned by qualified personnel of 2 cadres. Those are pharmacists and pharmaceutical technologists. We also have pharmacists who have specialized in clinical pharmacy, called clinical pharmacists. In total, in the hospital, we have 16 pharmacy units, 9 at the main hospital and 7 at the outpatient centers.
My name is Engineer Shama Kiteme. I'm the head of engineering, and we have been involved for the last couple of months in implementing infrastructure projects. Some of them, like lab, is now complete and in use by the users. We have now Western Entrance ongoing. Western Entrance is going to be an administrative building where we are going to host senior staff, and it will free up space elsewhere that can be used for clinical purposes. As of now, the project is over 70% complete, and we're looking forward to have it complete by the end of July, which will be very helpful in creating additional space based on our strategic plan. We also have the theaters, 2 new theaters that are under construction that will be in addition to the current 3 existing main theaters. These two new theaters will be used for purposes. As of now, they are over 70% complete, and we are also expecting them to be complete by the end of July, and they'll be in operation early in August. We have so far made good progress. All the equipment that needs to be purchased to make the theaters operational, some have already been delivered, and others are being delivered this month, so that by the time of completion, theaters can be put into full operational use.
You are going to have an opportunity for interactive sessions, during which you may ask questions. We shall take a few questions due to the time constraints, but we will endeavor to answer as many as possible.
Staff of Nairobi Hospital. My question is about the nursing management. I have realized they've been acting for quite a while. Is there any pipeline for maybe confirmation, or what is the board doing about it?
I think that's a management question, and the CEO is ready to answer you.
Thank you, Member. Chairman and members of KJ. We have finalized the recruitment, and those staff who have been acting, some have been confirmed, and some have been recruited competitively, and they will be reporting from 1st of next month.
For those who are logged in, we are still giving you an opportunity to ask questions. We have enough time now. One of the questions by the members who are logged in, Mr. Henry Wanga, we are happy to have an open day. Why don't you have a physical AGM this year? This was emailed to us and to you, Mr. Henry Wanga. We shall continually assess the prevailing circumstances for guidance on the most appropriate mode of conduct of activities and meetings, including the anticipated number of participants. I think that is the only question. Any more questions? Thank you.
Members, now we have come to the end of the 2023 KHA Open Day. Let me now invite Honorable Dr. Chris Bichage, the Vice Chairman of the KHA Board of Management, to give a vote of thanks.
Thank you. Thank you very much, Gilbert. I go ahead and give the vote of thanks on behalf of the Board of Management. The Chairman of the Board of Management, Dr. Wilfred Irangu Ndirangu, the members of the Board of Management, members of the Board of Trustees, members of Kenya Hospital Associations, distinguished members, management and staff of the hospital, ladies and gentlemen. Let me take this opportunity, Mr. Chairman, to thank you for hosting this unique KHA Virtual Open Day, which since 2019 is today a hybrid, because since COVID struck, we've not had a hybrid meeting in the past, but today we have a hybrid, and I think that is a lot of progress towards a fiscal meeting in the future. Mr. Chairman, you have taken us through the strategies the board has adopted to transform the Nairobi Hospital into a world-class health center of choice. To the CEO and management team, we trust that you will scale up the programs that you are implementing to enhance performance of the hospital and improve our patient experience. To you, KHA members, we appreciate you for taking time to grace this occasion by your physical attendance and also virtually. Finally, I would wish to appreciate the staff of the hospital and the organizers of this event for their sense of duty and commitment to our strategy's direction. God bless you and your families. Thank you very much, members.